Thanks everybody for attending. So it's my great privilege to give this grant writing seminar. I am beginning to really like giving this seminar, and I've spent at least two to 5 years kind of refining this concept that I'm presenting, and it's still a work in progress. Definitely not the perfect grant, but this is my best attempt at trying to teach someone else how to write a compelling, beautiful grant. Okay, so obviously I'm not the sole teacher in this. Make sure that you reach out to other people who are excellent in this area, and make sure you take the best from different people, different mentors that you are coming into contact with. So I prepared some slides, and the first part of this discussion will be mostly didactic. Then we'll move into the interactive piece. So we're going to discuss the importance of asking a good research question. A great grant starts with a good research question and a priority question. And then we'll talk about the process of turning ideas into fantastic proposals, and then spend some time discussing the mechanics of writing the grant, because writing a successful grant is probably the defining characteristic of a successful scientist, because there are a lot of people who want to do research, but if you want to start your career in science, you have to be really good at writing a beautiful grant. So I'm really grateful that you all joined us. Those are our 3 objectives, and we will go on from here. So how do we determine what is a good research question? So you're all early in your career stages where you can still mold and shape the types of research questions that you are going to pose in your research program. So make sure, take time at the beginning to convince yourself or have other people tell you that your question is important, it's novel, and it's driven by priorities set by the stakeholders who benefit from the answers. So this priority setting exercise is really, really important. So you have to know what's important to the people you're trying to make a difference in. So these might be patients, this might be policymakers, any stakeholders that are relevant to your research question. And then make sure that you answer unanswered questions. So sometimes you may need to do some baseline work to confirm the obvious, or asking a non-compelling question, but the compelling questions usually come from some sort of unanswered question, some sort of dilemma that has dogged child health research or science in general. So I want to encourage you to go for it and ask those tough questions, because if you're going to make a leap into these topics, you want to do it early in your career and spend a lifetime working on those difficult problems. So this is the time to have the courage to go where other people haven't gone before. And make sure that when you start out, that these things are feasible. The questions are, can be answered. So you pose questions in a way that it's feasible to attempt to get an answer. And then the final question, a final point on this slide, is that you are interested in this question. If there are people in your life who say, you know what, it would be great if you went into this area. It would be great if you answered that question. Well, if you're not interested in that, don't even bother. So it has to excite you. It's not your supervisor's research program. It is your research program. So I encourage you as junior scientists, trainees, to have a passion for the questions that you're answering. Otherwise, this is a tough job. Resilience is very important. So if you don't have passion and interest to start with, you may fall by the wayside. So make sure that the program that you're working on, the questions you're beginning to design, fit all of these criteria. Then in the olden days, people used to do research, kind of follow up on their supervisors' projects, or you think, oh, well, that'd be interesting to know. But in the new way of doing research, especially at the national, federal level, international level, it's priority-driven research. So what are the priorities for the stakeholders in your domain? And I just spoke with Tammy this morning. She works with complex care children. So unless you understand the patient perspective or the providers who provide care for those complex children, you are never going to understand what's the priority, and you're not going to be able to improve care. So immerse yourself and gain a holistic understanding of what's important to the people that the research will benefit from. And so that could be stakeholders, healthcare stakeholders who are providers or policymakers, and then of course, patient priorities. At every turn in your research program, you should say, what about this will make a difference for the patients? What about what I'm doing? How is it going to make a difference? Is what I'm doing resonating with the patients? Will they think it's important? So then you can start designing small components of your research program to address that, either to understand patient priorities or understand patient experience, or co-design and co-create questions with your patient partners. So this right now, even I know basic science so we have a separate talk for basic science because I know some of this may not be relevant for all basic science questions, but I would think as a general scientist that any question you ask in basic science would also have to meet this criteria, because otherwise, why would somebody fund it? So even if you're doing basic science research, this is very important. But more relevant in our type of research, today's grant session is about clinical and health services projects. So how do you ask a great research question? And of course, I'm sure you've gone through talks like this in grad school or undergrad or research courses you've taken. So this is only my answer to this. And I think I've already said this, but I'll reinstate. We can't provide patient-centered care if you don't ask patients what's important to them. No matter how obscure those questions are, that's still a good research question. This is not about how do you structure your objectives or anything. I'm thinking about the holistic idea of what's a good research question to go after. So it is a question that's important to the patients. It may be difficult to design a research project or an aim around that question, but that's challenges ours to do so. So priorities for research can be elicited from patients and providers, and with the right study, they can be answered. So don't go to the easy things. Yes, you can do that as a start, and there'd be components that are easy in your programs, but always, for example, I'll give you an example. So somebody did this research at the University of Calgary to understand what are the patient priorities for research in patients with chronic kidney disease or on dialysis. And one of the top priorities was how to reduce itching. So when you have end-stage renal failure, people get severe itching. And this is a life-limiting thing. So for quality of life, itching is a major problem for which there's no solution. There are no medication, but that's a priority. How do you study that? How do you make life better for patients with itching due to kidney disease? So that's a question that's important to the patient, but difficult for us to answer. But with the right scientists and the right approach, you may be able to chase that and actually find a solution and make life better for millions of people with end-stage renal disease. But if we never even tried, how will we even get there? So this is not about the mechanics of asking a research question. It's about not shying away from the questions that are difficult to answer, which the patients would prioritize. And these are great research questions. So you say to CIHR, you know what, I'm going to develop a research program around itching in end-stage renal disease. You think, well, what is that? Is anyone going to fund it? But you say, you know what, we've done a lot of patient-oriented work, and we know that itching is their primary concern. that inhibits quality of life or life satisfaction or life participation or whatever you want to call it, then CIHR is going to think that's exciting. That's going to, and then you say, well, you know what, 10% of all Canadians have chronic kidney disease, 2% of all Canadians have end-stage renal disease, the numbers just go up, right? So the impact of your work becomes really, really significant. So you have this great idea. So you want to solve itching, let's say, in kidney disease. So what do you do with that? And so this is where, and I had some of you who are new investigators in the Pillar program, I had some discussions about how to brainstorm and create a grand concept. And this is a time-intensive, iterative, difficult process where you have to engage with the different stakeholders, patients, policymakers, your colleagues, experts in the field, statisticians, because yeah, you want to solve itching, but how do you solve that? You don't have power, you don't have numbers, you don't have methods. So it's an iterative process, and then you start carving out pieces that are solvable, pieces that you can address. And then you draw a nice concept map and say, okay, in the beginning, in my PhD program, I'm going to address this. In my new investigator program, I'm going to address this at the first start. Then I'm going to deal with the next piece, and I'm going to build incrementally. And even that first objective that you come out with, it takes time. And so don't be frustrated at this stage. If somebody says, well, that aim, oh, that doesn't make any sense, how are you going to do that? Keep at it. Don't give up. Go back and forth with the different people you have pulled together, your mentors, your statisticians, your team around you, other experts, have lots of discussions, use whiteboarding, and then come up with the concept. So, so then you come up with the design, something to explain. So in health services and clinical research, more and more now, it's mixed methods. You're going to have to use multiple methods to bring out the answer. So when I say mixed methods and multiple methods, I do mean that they're different. So you use different types of methods in your mixed methods design, let's say, to come up with a holistic answer for your problem. So you could just use one method, like a quantitative straight association study, or you can weave in a qualitative project and then have a priori design where you are, deliberately setting out to create a mixed method study. Or you can use multiple methods. I'm going to use method 1 for this question, method 2, and then I'm going to bring it all together later. So essentially, you create some sort of design for, depending on the question and the type of research, and then explain why you're doing that. And then you set your framework for your grant. So all of this is very intensive. You got to work with your methods team, your mentors, etc. This is where CCH-CSP cannot be all that helpful to you. This is where you need to work with your local centers, book time for chalk talks. Usually your research institutes will help, etc. And that this is a big part of beginning in research, and it continues to be for every new project that I do. Then understand your limitation. I find I have a lot of colleagues who are interested in research who have grandiose ideas for research. Like, they want to solve the world's problems, but we can only solve one very focused, or we can only work on one very focused question at a time. So a good example is my own work, which is transition to adult care. So when I started in research, they wanted me to solve everything from how to implement at the clinical level to transition to the adult care, and like the whole, basically innovate and improve all of transitions to adult care in hospital, community, etc., etc. I said, no, I'm a researcher. I only answer one question at a time. I'm going to study whether a patient navigator will improve patient experience and decrease emergency utilization among transitioning patients. And that was it. That's one narrow question. It was a big study, one narrow question that I asked, but I continue to work with the stakeholders and the policymakers. And today, just before this meeting, I had a meeting with the leadership at my hospital, and that study has now will be leading to a nice packaging of transition services within the hospital, which addresses all the points that I couldn't cover in my focused and narrow research questions. So know your limitations, prevent grandiose ideas for research, ask one focused, feasible question. So how do you get it done? Let's say now you got the right question, you got the right people around you, you got the right design. Now you need to write it down, to tell others what you're doing, to get money to do the study, to have a protocol that's ready and actionable. And without a shadow of a doubt, I can say that when you have spent an incredible amount of time preparing your research protocol and you get it through a national funder like CIHR, that protocol will likely need no revision and it's ready. You can hire a research coordinator and you can give that protocol and they're going to execute it with minimal revisions. So your grant and the study protocol is already done once your grant is done. So that's the level you want to get your grant submission to, because if there are too many questions, loose ends, when your project coordinator picks it up, then you haven't done your job and at writing it down properly. So for me, once I've done the protocol, like even this new training grant, there's going to be some operational details, but all the concepts that are in there, all the curricular materials are in there. There's going to be minimal work to refine everything. It's ready to be operationalized. So that's what you want to get your grant to. So now I'm going to shift to, we have about 20 minutes, and then we're going to take maybe 20 to 25 minutes, take a few minutes break, and then we'll regroup with our, sample writing. So tips on writing grants, and you can call my session, you can say it's general writing tips, and it's going to be the same for every type of scientific writing. You have to know your audience. You have to assume an intelligent reader, not an ignorant reader. These people are smart. And then what I am increasingly saying, it's a duel between you and the reviewer. You are basically engaging their mind while they're reading it. So they're thinking, so you have to pretend they're right there when you write the grant. So if the reviewer has a question in their mind, you should be able to answer it in the written format as soon as that question comes up. So a beautiful grant, if you get feedback, it'll look like this. Wow, this grant is amazing. As I had questions come up, they answered it right away. So if you think their reviewers are going to ask some questions, answer it within your grant. So you're not writing to an ignorant reader. You're writing to an intelligent reader who's engaging with you as a writer. And don't use jargon if writing to general medical audience. So almost universally, there's jargon in our writing. So what I would say is, it doesn't matter if you're a neuroscientist writing to a neuroscience panel or basic scientist writing to a basic science panel, minimize jargon, communicate in lay language as much as possible, communicate to the emotion of the reviewer. You have to evoke emotion with your writing. You have to compel them to fund your study. So if you give them a bunch of, kind of lifeless scientific writing without any context or meaning, nobody's going to get excited about that. I can guarantee you that I can take each one of your research areas and I can make a newspaper story out of it. That's the type of level you want to get to. So don't be afraid. Get passionate. But there are some superfluous writing that shouldn't be in your text, which I'll talk about later. But that passion, the excitement, the urgency to do this work, you have to convey that. The only way to do that is to write as if you're writing to a general medical audience or a general reader and impressing upon them the importance of this work. Then one of the major pitfalls is when you don't have clarity in your own mind regarding the plan. So if you are fuzzy in your mind, the grant will be fuzzy. So you want to be very clear. These are my aims. This is my plan. And this is why I'm doing it. That has to be clear in your head. And then your goal is to refine and bring that clarity into the written word. Okay. None of this is easy. It takes time. So don't stress, lots of practice. Okay, so how do you get there? Read successful grants and ask for sample grants in related fields from colleagues. So I'm more than happy to send around, and Linda, I sent it to somebody yesterday, my whole transition to adult care grant, the one that I just told you about, because I think it's already been available in a U of C repository. So there will be people who have successful grants in your fields. Read a lot of them, emulate what speaks to you in that grant. What I did was I read a lot of my mentor's grants. She was very successful. She was a good writer. I would read her and some of her colleagues' work, and I'd put that in one hand and put my grant in the other hand and try to adopt the tone of how they're writing. And so I kept doing that over and over again, because I had like 5 failures at the beginning. And then I kept asking, why are these guys writing such simple, silly grants and they're getting funded, and why am I not getting funded? And my ideas are so great. Well, first of all, I had to humble myself. Secondly, I figured out that that simple communicating simple ideas to the simple reviewer's mind, busy reviewer, is very effective. So I adopted that tone, and I have to say that I had like 5 or 6, like I submitted 6 grants, and 5 of them were successful. And I'm like, oh my gosh, how did we do that? And then I had a massive failure last year. So then you come back down to earth. So again, so you have to figure out what worked and what doesn't work. And you have to have good insight into your own strengths and weaknesses to understand what it is about your writing that's not working. Okay. And work with people like myself who never let people off easy. Like I got fired basically from the resident research course by the residents because I think I was just too much for them, but I wasn't. It's just that when I gave feedback, I gave specific feedback, and I told them in specific areas where things need to improve. Not everybody is ready to take that feedback, but you can't have that attitude in science. You want a heavy red pen mentor, because almost everyone needs that red pen redirection to become a good writer. So then volunteer to review others' work, and peer review committees. We talked about in some of our meetings, if there's any chance to be an observer or reviewer, take it. And we're going to do a little bit of that later today, so it'll become obvious. Okay, so now I'm going to go through some stuff pretty quickly. So people ask, you know, do you have recipes? I actually have a recipe, and you can use it or you don't have to use it. And I teach the same way all the time. And I think it works if you can figure out what I'm saying. So how do you set it up? You know, the grant, the background and the rationale. This is it, folks. 2 pages to get them excited. If you don't get the reviewer in these first 2 pages, you are dead in the water. So if you were to divide a grant into 2, it's the introduction and the methods for health services and clinical research. Both of those components are critically important. If you have the introduction, you don't have the methods, people like myself who are on panels will not fund it. And there are people who do the others too. The introduction is poor, but the methods are great. So, but to get a winning grant, you need a good union of these 2, and both have to be excellent. And the methods include the knowledge translation plan. So how do you start the writing process? And for me, like Linda went through this with me, I'm not sure if she's listening, but I wrote some really terrible drafts of my recent training grant. The first one was so embarrassingly terrible, but I wrote it specifically like that. I just wrote what I had in my mind, the story that I wanted to tell, the compelling rationale for why I am competing for this new national training grant with this team. So it was, and Linda can share probably some of the early drafts. It was really off kilter, but I just wrote free flowing. I spent 1 day here in the same office. I just wrote everything that I had in my mind. And then I send it out to my colleagues and they're like, well, this sounds terrible. But that was just my thoughts, rough thoughts. So how do you take those rough thoughts and then you come to the final grand submission? So the way I do that now is I tell everybody is what is known, you write that down. What is not known? What do you want to find out? Why is it so important? And the methods piece is how will you do it? But in the introduction, you have to answer these questions. And by the end of the second page of a standard 10-page grant or the 1.5 pages of a standard 10-page grant, the reviewer should say, I know what they're looking for. I know what's not known. I know what they want to find out and why it's so important. And I think we should fund this study. So they're already excited, ready to read the methods, you know? So if you don't get them in those 2 pages, it's not going to happen. And it's the same with the training grant or training award. So you have 1 page to explain yourself. I'm going to get to that, Christy, 1 second. 1 page to explain yourself. So you have 1 paragraph or maybe max 2 paragraphs, and you have to answer these questions. Okay, go ahead, Christy.
Sorry, I was just wondering, kind of trying to keep the that 10-page allotment under this kind of 1.5, 2 pages in here to sort of a summary paragraph to start, like to pre-introduce this introduction to the, you know what I mean? And then trying to budget your time.
Yeah.
Is that a paragraph? Oh, sorry. Yeah.
Yeah. So overview, are you talking about the overview?
Yeah.
Yeah. So in that 2 pages, you have to put the overview in.
Okay.
Yes. Linda, can I will send you something during the break, and if you can forward it to everybody. That grant has an example of how I've done that in very small space, and it's usually a picture, and I'm going to show you that picture in a few slides, and then a small amount of text. Basically, so the first paragraph for your introduction contains almost everything they need to know to get their mind ready to read the grant. Okay, I'm going to show you an example and when you get the summary. I mean, my sample grant. Okay, so is everyone okay with this logical flow? And so to challenge yourself, takes what you've written, read it in your mind, and then I challenge each of you to record yourself on Zoom or stand up in front of your relatives who are not medical or friends and read it out. You're going to naturally flourish it and take those natural flourishes, put it into the grant. Then you're going to create a more compelling grant. Right? Because you're going to have to explain yourself at every turn of your writing to say why you're saying what you're saying. So why not just start with talking first and then insert all the science and the statistics and the data to support what you're saying? So that might be a better way to get started and to adopt this, this style of writing. Okay? Is everyone with me still? Okay. So yeah, and this is what I think Christy was asking me. So the first page is an overview summary, 1 paragraph and hopefully 1 figure, hand in hand, to explain right at the beginning of the grant. And I'm not a writer. I don't write creatively or anything like that, but I learned how to write through this process. So every creative writing tip is useful in a grant. So if you're a natural writer, use everything. Foreshadowing is something that I use often in my writing. You want to be as concise with your words. Parsimony of words is key to grants, because too many cognitive jumps in your reviewer's head, your score is going down into the boots. Simple sentences, fewest words. If you're having to put too many commas and too many long sentences, no. And it contains, that overview has everything they need to know. And then you create a nice grand concept and a workflow or some sort of diagram that explains your whole grant. And that takes time too. Everything takes time. There's no shortcuts to this, okay? So if it's going to take time, don't get frustrated. Oh, and So the background is a persuasive essay. So mastering the thesis statements is my style of writing. And you'll see this in the example that we send around. So each paragraph should have a thesis statement right at the top. One idea, one paragraph. And now I'm going to add another thing to this, which I came up with yesterday. One idea, one sentence. Because I've been reading some of your work and, or actually my local pillar trainees work, and I see that you're just double backing ideas in sentences. It's too many cognitive jumps for the poor reviewer. One idea, one sentence, one idea, one paragraph. And then frame your logical example of arguments for the study. And I'm gonna hopefully show you the example. So here is I'm gonna send you this grant. These are the leading sentences of my background with the objectives and significance. So I just copied what I'm gonna send to you. This is it, the background. Transition is a process. Short, snappy sentence. This is a long sentence. The next one, because I couldn't find a better sentence. Majority of adolescents in North America living with a chronic health condition will require transfer from pediatric to adult services. There are reasons why we retained all those words, because we have to explain ourselves. Suboptimal transition to adult care leads to, here it's usually X, Y, Z, showing the outcomes that I'm interested in, emergency room visits, death, whatever. Then I go right into, but patient navigators are a promising but unproven intervention to improve transition to adult care. Therefore, the objectives of my study are 1, 2, 3, and then I reassure the review, we're well prepared to undertake this RCT, and the results will have potential to change. That's it. So if you write a logical framework like this, and then you flesh out each paragraph, one idea, one paragraph, you're going to have a compelling introduction. This takes time. Okay. So then so that's the whole introduction. But I told you about that overview figure. I created one figure that basically summarizes the essence of the grant. It can be anything, but it has to visually make sense. And we adopted the similar sort of thing for the training grant we submitted, because this is the only idea I had. So the pictures tell the story: variable, uncoordinated, fragmental, transitional care. What are we doing? Which is usually what am I planning to do about it? I'm going to do a pragmatic RCT with the primary outcome. So I've got a little ambulance going there, different measures and stakeholder perceptions. What are we going to do with all the results? Well, this is about KT. We're going to talk to people. We're going to scale and spread the results. And what happens at the end? That we have better patient care and outcomes. So the figure just naturally, without too many cognitive jumps, and people read from right to left, takes you through the whole grant. And that was it. And in fact, this trial got funded. The first round, it was submitted to CIHR. It was not the first time I wrote it, because we went through some local competitions. But we got money the first round and full money the second round. So we got more money than we asked for. And then in the reviewers' comments, they came back and said how wonderful the figures were, and that helped them understand. So invest in figures, okay? So try to explain your whole project in a figure like this, right on the first page. And if you force yourself to do that, clarity will come in the rest of the document. Okay, so did I miss a page? Okay. So I talked about writing, and so everything about creative writing also applies to grants, and I have a lot of fun with it. I use foreshadowing. I sometimes even, I had to mention this, my favorite writing technique is use alliteration. You're having fun with writing, right? So you want to put things in the writing that excites the reviewer, just in their creative mind. So something that I usually use in grants is symmetry. And this is very important in methods. So because people like seeing things in nicely defined boxes, and they like to follow things along. So the method should be written in a way that you have the methods, like what you're going to do, and then the analytic plan for each method should be symmetrical. So the reviewer gets an idea of how you're going to get the data, and then you matched with symmetrically with how you're going to analyze the data. So look at the way you're setting. So methods, you can use the strobe guideline, population, design, setting. All of this is the same for salary awards, okay? Even in that one pager. Population, design, and setting, study duration, etc. And then what are the comparisons you're making? So don't just say, I'm going to look at the associations between X and Y. You're going to say, I want to know if what's the relationship between X and Y, whether some things go up or down. Like, make sure that you're explicit in general language, saying, okay, let me back up. People say, oh, I'm looking for predictors of this. Well, you can say something different by saying, well, I'm interested to know if older age is associated with an increased risk of death, rather than saying, I want to know if age is a predictor of death. Did you catch the difference? I see that in writing all the time. So you want to be explicit about the comparisons you're making and why you're using those exposures and those outcomes. I see some pensive. Have I made sense? Okay. Yeah, go ahead, Christy.
Can I just add, and this should be then in the methods. So if I'm saying that predictor statement, that I would then kind of be, I guess they're not really, they're sort of hypotheses, but in terms of the trends that you're maybe expecting to see, you would maybe put that in here?
Yeah, so if you have a hypothesis statement, that's fine, but don't just randomly say you're looking for predictors of this and that. You want to explain to the reader what it's predicting. Why is one related to another, and in which way you expect that direction to go, whether it be in the hypothesis or in your analytic plan, but you have to put it somewhere, right? This is a general comment about writing. It's not specific about methods per se, but I read a lot of grants where people don't even know what they're saying. They're just saying, well, I want to look at predictors of this and that with that. Well, tell me why these predictors are important, which way the associations you think are going to go, and in which direction which way the associations will go and what that means. So if older age is a predictor of death or is associated with increased risk of death, then what are you going to do about it, right? So that's the kind of lay language you have to incorporate into throughout this proposal, not just in methods, to make a compelling case, rather than saying, I have a list of 10 covariates and 10 outcomes, and I'm just going to look at which one's significant, which is what most grants, even at the CIHR level. I'm just simplifying it at a very high level, but that's absolutely true because I serve on the health services panel occasionally, and that's what happens. So don't do that. So pick a few of the covariates, convince us. And that's the next point. Define all the exposures, interventions, outcomes. First thing, start with the outcome. Say, why is this outcome so important? Well, death is important. I mean, whatever outcome it is. And yesterday, I was talking to somebody else, attention and learning deficits. Huge issue for child health. And so you start with making a case for studying that outcome. And then you say, okay, mild brain injury is associated with increased risk of attention deficit, learning, whatever. And that's what your study is going to show, hopefully, if your hypothesis is correct, or if your hypothesis, you're testing that hypothesis, then you can do something about it by designing interventions for mild brain injury, for example. Okay. So in the methods, the symmetry is more important in papers, but in grants too. So if you have a certain objective and you have written a certain method, write an analytic plan. So match all the proposed aims and analysis to appropriate statistical methods. So you have a primary question, primary outcome, and the primary analysis. So the reviewer has to be able to string this through right along. They have to search around for what it is for each objective. That's when things get really, like your score goes down, okay? And that also shows to us as reviewers and me as a writer, it should signal to me I'm not clear in my head what I'm doing. So keep it simple. Okay, then don't get too creative. Even though I said many times, use your creative writer in you. I don't mean creative in the structure of the grant. You want to write beautifully, but don't get too creative by putting a classic example, ECR grant panel. A wonderful person who shall remain nameless because of confidentiality, it's an ECR panel, let's say, writes her first grant. And she puts in a quote as the title, you know, some sort of philosophical quote. The reviewer has no idea what this quote means, and the grant doesn't even match up. So already you're dead in the water, right? So don't do funny business. Stick with standard titles, like, you know, you might want to give a design, like explain your study by providing the design, even in the title, an RCT, a prospective observational cohort study to evaluate the effectiveness or whatever. So use standard sections, don't do any funny business, but within the paragraphs, you can use all your creative writing if you want, but don't use superfluous language. And I'm going to get to that. So a standard health services grant has introduction, methods, analysis. Remember the methods and the analysis symmetry. Remember the 4 questions or 5 questions I asked you about the introduction. Research team and roles. Be honest, be transparent with them. Who's going to do what, who's involved, who's helping, etc. Feasibility. Don't have any grandiose plans. Be real. How long is this going to take you? What's it going to require? State the upfront limitations. This is where you start. You want to answer those questions the reviewers have. So for my transition grant, there was one particular question that I knew the reviewers will have. So we put it, actually, we didn't even wait for the limitation section. We put it right up front when we know they're going to start thinking about it, and so on. And then KT, it's something that it goes back to the beginning of what I talked about, is you have to always have that perspective. Who is this for? Right? So it should be woven throughout the grant. This grant is, unfortunately, I hate to say it, although we're all researchers, the grants, if you get them, it'll advance your career, but it's not about you. It's always about the patients or someone we're serving. So if you write a grant with that perspective and that patient voice in your mind, put that parent's voice in mind, saying, I spoke to 10 parents and 5 children, and this is what they told me in my priority setting exercise or our initial meetings for, you know, the integrated KT approach. Put that right into the grant. Tell them the story, why the parents demand this information and how it's going to inform their care later, right? So that's why I would think a beautiful grant has KT woven throughout. Because tell them why you're doing what you're doing right from the beginning, and it should have all the stakeholders involved along the way. Okay, so I think we're getting to the last couple of slides. I'm a bit over time, so let me go through this quickly. There's some soft skills for grants. So you have to defend your time. If you don't defend it, nobody's going to defend it for you. So don't blame other people. You don't have time to write. And this is something, as a scientist, you have to proactively know your best time to write. And I also talked with some of the pillar trainees how to create some wellness space, thinking space, dead space in your mind to get those creative, innovative, beautiful ideas out in your brain. And then you have to come and write it down. So don't think you can come at 9 a.m. and spend 3 hours writing and all your best ideas are going to come out in that 3 hours. Usually for me, by the time I've left the house after my wellness routine and having had dealt with the children and all that, I already have the idea in my head. So my ideas usually come between 5 and 7 in the morning when I'm really relaxed and I'm doing my wellness things, exercising, reading, devotions, etc., meditation, and then it just comes out. So you have to know who you are and where those ideas come. Your creative mind is most active. It could be in the nighttime. And then you follow that up with a writing zone where you come to the office or your home or wherever, and you basically turn off emails and whatever else and start. And even if it's junk, like I told you, I just free flow right now, write what I need to say because I care about the problem, and write as if you care about the problem. Then you can fix the writing later. And maybe another session I can go into why I'm saying that, but basically you want to write the story about why you want to do what you want to do. Then you make it more scientific by inserting arguments for why you're doing, by inserting literature, the stakeholder work, the priority setting, all the people around you, etc. So first get the ideas down. Then you have to defend yourself against time wasters. And I have one of these at the beginning of my career who was my next door neighbor. So I learned quickly how to deal with that. So you have to use your defensive strategies. And Richard, our co-director, gave me another thing: eat the frog first. So whatever is most difficult, do it first. Don't put it off. So you have to use strategies to defend yourself against all these kinds of things. For me, like, it's email, and nowadays it's cell phones. So I've turned off every single notification on my phone. And I will turn off my email when I'm writing. And I usually now, I just close my door, and that's usually means please don't bother me, or put a sign up. And again, write your every day, look stupid, that's fine. I've done it many times and still am. Write, rewrite, put it away, and then try to read also your writing during your most creative time, because then ideas will be like, oh, why did I say that? Oh, that's, I could say that better. So make sure you allow time to do that. And we've talked about many of this along the way, but simple English, active voice, I will, we must, we, not I, sorry, we will, we must, never use the word I. And always talk in the imperative rather than passive voice, like we have, or we hope to, or we may, don't do that. Active, always, I'm on mission here, I'm going to get it done, and I'm going to convince you. No hyperbole, nothing too grandiose about yourself. I don't care if you're the world's greatest scientist, I don't want to read it in the grand, because nobody will believe you. You may be the first, you won't be the last. Don't even put things like that. It just puts people off. Be humble, be sincere. But think about, it's not about you. It's about the cause that we're working on, right? It's about the kids. It's about their care. Put them first in your writing. And then when you come to the team, you can say, Dr. So-and-so is a productive researcher with an excellent track record and has these awards and is ready to do this job. That's where you talk about yourself. Or you can say Dr. So-and-so has collected this much data and have some, is prepared to do so. But it would be much better to say our team has prepared this data and preliminary, everything is set up and we're ready to do this work as our next natural step. Then know your handicaps. So if you're writing the same words over and over again, highlight it, thesaurus, use the thesaurus, get another person to edit, and then meticulous proofing. And I've become a meticulous proofer. Even with my meticulous proofing, I'm still making very few errors. That's very annoying for the reviewer. So you want to be very good with your grammar, spelling, spacing, fonts, all of those things, a beautiful product that comes out at the end. And then use as few words as possible. And it goes without saying, white space is important, okay? So don't try to cut the white space. That's just going to work against you. And then we talked about jargon. We talked about superlatives. Nobody is so stellar. Speak in real terms. Dr. So-and-so is, you don't have to say world expert. You can just say Dr. So-and-so is an expert in brain imaging and will assist the team with interpretation of this data, period. They can look at the CV and find out he's a world expert. But if we say that, another world expert could be reading the grant as a reviewer. So, and repetition is good in selective places. That's another writing technique that I use just to remind readers. So selectively, but not always. Then I'm coming back to this explanatory language piece. This is more important for a paper, but you think about where it could be relevant for a grant too. We found, and this could be in your background, for example, in your, in your preliminary data or something, we found that the group exposed to the intervention accessed health services fewer times than the control group. This is what I was trying to explain, like, I'm not just looking for predictors of this and that, you're explaining the result, the math, using lay language. So you want to adopt this type of writing throughout the grant and explain the literature you're citing, and this, for example, this sentence could be justifying my reason. And I think I actually took it from the reason for why I want to test this intervention in an RCT. Okay, and maybe that was an observational study. So I think that is it. And then we talked about all of this, which is red pen and get a critical reviewer. First drafts are terrible, and all of this will take time. So why don't we pause here?